So my name is Dr. Stephanie Hartselle. I'm a board certified psychiatrist and child psychiatrist. I am the owner of Hartselle and Associates. We are a multidisciplinary group who sees patients of all severities. And I'm here today with our behavioral specialist and coach, Evan Hartley. We are talking about a completely made up case. This is not a real patient, but we're talking about the difficulties that one would have with something that was pretty severe anxiety, and how coaching works, how a treatment team works, and how we use this multidisciplinary group to really help kids and young adults who are struggling. So, Evan, I'm going to give you a case,
Sure.
and we're just going to talk it out. This is a 20-year-old man who has a history of inflammatory bowel disease. So, this is an autoimmune condition that he's had since he was young. And when it gets bad, it can flare up his intestines and he can have bowel accidents. And that happened in elementary school quite a bit. They got, it diagnosed and treated with medications and it calmed down, but it happened so much that he just wouldn't go back to school
Sure.
at that elementary school, kind of understandably. They transferred schools. His flares decreased. He had not had any problems with that throughout junior high or high school, and got into, a really good college he's looking forward to going to. He is approaching sophomore year, and it's the summer. And in June, and we don't really know why, but he started to have flares again. And at first they were, minor, and then they became really major. And he was having accidents at home and was really concerned. They went on a road trip as a family. They're from here in Rhode Island. And they stopped in a town where they didn't know anyone. They were at a restaurant, and he had an accident. And, it wasn't the whole restaurant, but a decent number of people could tell what happened. They turned around and came home. And at this point, he will not leave his room. He'll see his GI doctor, and he'll see me over Zoom. I'm his psychiatrist, and I'm also his therapist. He has a history of generalized anxiety disorder when he was younger. Just a lot of worries about home and health, and this was while the inflammatory bowel disease was calmer. Um, they took him to a few therapists. He didn't like any of them. He did feel like he took away some good points, but he really didn't like therapy, and that seemed to have calmed or been driven into his, desire to be in a really good college. He'd like to be a doctor someday, but he's stuck, and he is just in his room, and will not go anywhere, and he's scared his whole life is over because, he never wants this to happen again.
Sure.
Um, so today I just wanted to talk about what is, a lot of people don't know what behavioral specialist and coach does, and like how you would, just lost an earring, how you would approach this situation and be a part of this team, especially with a kid who does not want to see anyone really. He barely sees me. He'll talk some, but like, you can tell I'm still trying to build rapport, and I don't see him, I see him an hour a week. And you are now deployed to
Yeah,
the home. I'm gonna take off my earring and take it away.
there you go. This sounds like a great case for coaching. Coaching can be used for anyone, for any sort of circumstance, but I think coaching really, really works in cases where like there's some either whether it's white coat syndrome or people just don't like therapy in general because your typical therapy can be stuffy and it can be boring and it can feel just intrusive for no reason. Coaching brings a different approach to that in the sense that there's no clinical coaching degree. Your coaches like myself kind of have to show up on the ground floor and meet them wherever they're at. So I'm not going to be meeting him. He's not going to be sitting on a leather couch and I'm going to be sitting in my office chair like your typical therapy session. I'm going to be going to his house in his where he is most comfortable, right? Obviously, this is where he wants to be. And this is which is an issue because he doesn't want to leave. So I'm going into his space. And because I'm in his space, it's really important that we build that rapport. Rapport is number one. Rapport is absolutely number one. And I'm going to be, eventually challenging him to do some pretty difficult things. Before that, I need to know him and he needs to know me. We need to know each other on a pretty, a therapeutic and a personal level. It's important. I know when too much is too much. Overexposure is a thing. If I overexpose, that means I'm terrorizing them. That means it is too difficult, which can further traumatize said patient and also break trust, break rapport. And that's the last thing I want to do.
Yeah.
Um, and the first several sessions, we're probably not going to be doing much exposure work. It
Yeah.
might not look very therapeutic because whatever he wants to do, I'm going to do. If he wants to go for a walk, let's go for a walk. If you want to play video games, let's play video games. We're hanging out, right? We're not buddies, but it's going to kind of feel that way. I want this to be somewhat fun and somewhat motivating. I don't want this to be the worst hour of their week
Yes. Yes.
by
That's a
any
very
means.
good point.
By
Yes.
any means. Life already sucks right now as it is.
Yeah.
I'm not here to make it worse.
Yeah.
Eventually, when it's Wednesday, 2 o'clock, and Evan's coming over, and this isn't the worst thing in the world, I might say, hey, let's step foot outside. It's been a while, right? There's a possibility you'll be in content. There's a possibility you might have an accident, right? But we're just going to step outside 30 seconds, boom, we're going to come back in. I'm constantly trying to have someone find what I call the I told you so's, right? And I told you so is exactly how we're going to try to quiet that anxious mind. So when your mind, sometimes depending on the age of the patient or who I'm working with, if I'm working with a younger kid, I'll call it like your bully brain, right? We have this little bully in our brain that says, hey, if you leave, you're going to poop your pants, right? That's a really, really believable thought because it's feels like it's our thought. I'm going to go in and I'm going to separate the two, right? There's your brain,
Yeah.
and then there's this bully brain. We're going to depersonalize that.
So separate it out so it makes it something that is manageable
Manageable.
and confrontable.
Sure, sure. Anxious folk, and I say us anxious folk.
I do
And
too.
yeah, I say us
Hello.
anxious folk, and then
Yes.
and us anxious folk, we're control freaks. We feel the need to control every single aspect of every situation, and if we can, there's nothing to be anxious about. There's no what ifs
Yeah.
because we're controlling it.
Yeah. We think
Something
we
like
are.
IBS, right?
Yeah.
Something like IBS, we don't know. That is a lack of control, which causes us to stay sheltered and stay isolated. So I really want to be able to give this guy control. I want to give him the reins and say, hey, finally you have a little control. So a lot of it is going to be in his hands,
Yeah.
in terms of what
Love
we're going
that.
to do.
Yeah.
Um,
You put that in their hands because I can imagine as a parent and as an anxious parent, you would be like, well, he's been in his hands. He's just going to sit in his room.
true, true. And then that comes down to motivation.
Yeah.
Um, a lot of anxiety mirrors depression where there's this hopelessness and helplessness. I can't get better. I'm stuck. I'm stuck. I'm stuck. We can call it whatever we want, right? We can call it GAD. We can call it MDD, depression, anxiety, OCD, whatever disorder we want to throw at it is kind of going to be treated the same way and is presenting very similarly.
The stuck.
Yeah, feeling really stuck. And if there's no motivation, part of my job as a coach is to find that motivation.
Yeah.
That motivation is not going to just slap them in the face one morning and they're going to say, oh boy, I'm ready to get better. They're going to continue to sink and get buried by this hopelessness and helplessness. So through motivational interviewing and some values work, I really want to find, hey, life isn't that great just laying in bed all day. What are we missing? What is it? The doctorate degree you want? Is it friends? Is it your favorite restaurant? Is it what was life like before there was this fear of having an accident? I
Yeah.
want to reach back to that. And I want to use values as, it's this compass and I wanted to kind of which direction do we want to go in? And I want to use those values as motivation to get better.
Yeah.
Uh,
And as I'm working with the GI specialist, obviously, everyone's goal is to make sure that the bowel isn't inflamed both for health, but also for these incidents.
mhm.
But even if even if he's been accident free for weeks and we're pretty sure we've got it, completely under control, I can imagine clients are just still in the room because their brain is saying it's still going to happen.
Sure.
Yeah.
Sure. This, and I'm kind of throwing a bunch of different parts of
Yeah.
coaching. And these are all there's no particular order any of these things are going to
Yes.
be touched upon during a session. If we've exhausted all of these different approaches that I've tried, what we really need to start focusing on is acceptance.
Mm,
Radical acceptance is a really powerful thing.
yeah.
Um, And, there's a big difference between accepting something and agreeing with something. We're not agreeing that life is great, with
Yeah.
IVF. But if we agree, if we accept that, you know what, I have this thing and it sucks, but I have a life to live, it can make it much easier to take this risk. Where every day we're walking out of the house, we're taking a risk.
Yes.
His particular risk is I might have an accident. Um, so the exposure there is I'm taking a risk. I'm stepping out of the house.
Yeah.
You know,
Yeah.
I would love to get to a point where this kid says, man, I really miss making something up. I really miss Antonio's on Thayer Street. Well, someday we'll be able to walk the 10 minutes down the street and sit outside, have a slice of pizza, and walk back. Because not only are we leaving the house, but we're putting something in our body, right?
Exactly.
That
Right.
doubles down
Right.
as an exposure. And
Yeah.
sometimes exposures happen and they don't know they're doing an exposure. And I won't say a thing until afterwards and be like, hey, buddy, when was the last time you had a piece of pizza? 4 weeks? You just had one now, right? And
In
then
public, right?
that can be so when we get home, we left, we were out of the house for an hour and we ate a piece of pizza and we didn't have an accident, we're going to look to our anxiety or our OCD or whatever part of our brain said don't leave, and we're going to say, I told you so.
Mm,
You were wrong.
yeah.
And if we can start proving those thoughts wrong, we're going to start defying them a lot more.
Yeah.
We're going to start defying them a lot more.
So,
You know,
searching for that too and seeing that, recognizing
sure.
those achievements as, and also saying, I told you so. Again, like separating out, who you are and who your values are
Yeah.
from the loop that is telling them to stay safe and stay in their bed.
Yeah. I about 2 years ago, I had this epiphany in my personal life. My OCD anxiety has always been around teeth. I had this really traumatic experience as a kid, and teeth stuff was really scary. I had to go to like this phobia dentist, and that was helpful. Then he retired, and then I was left without a dentist for like 7 years, and I was terrified. I was too scared to go back. I would lay in bed and be like, "Oh, I feel a cavity there. This tooth is chipped," and through my own exposure work with my own therapy, the first step is I'm looking for dentists, and boom. Next step is I'm calling around and seeing who's taking new patients. And I would call, they would pick up, and I would hang up. So scared, 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 scared. Eventually, I worked up to making an appointment and showing up to that appointment. And I went in convinced I have 7 cavities. And I could have told you exactly where they are. 1, 2, 3, 4, 5, 6, 7, boom. I'm like, as long as I have 7, and this is gross, but as long as I have 7 cavities or less, it's a good
I'm okay.
appointment.
It's okay. Yeah.
Yeah. I didn't have one cavity.
You didn't have one cavity.
I didn't have one cavity, right?
Yeah. Your
So
brain was lying.
and that was the big mind blow where I was so convinced. I mean, it was keeping me up at night stuff. Like I wasn't sleeping. How am I going to afford this? The dentist is going to shame me.
That shame, the shame, right,
All
exactly.
of
It's
these
gonna
things. And I
hurt.
go and they're like, oh, you haven't been to the dentist in like 6 or 7 years. I'm like, no. And they're like, well, you don't have any cavities. So I guess what I must have been like brushing extra careful and flossing a lot to overcompensate. Once we realize how much our brain does lie to us and that our thoughts aren't true, then we're going to start defying what it tells us not to do.
Yes, and this is
And that was
why
a big breakthrough
that's
from my personal.
important. And the fact I think, Evan, too, that you share this, depending on who you're with and if it's appropriate. Um,
Sure.
but I will do the same. Have had cases recently where women have been pregnant, had to make decisions about being on medication while pregnant. I
Yeah.
discussed the fact that I did choose to be on medications while
Mhm.
pregnant, and I felt like it was the right choice for me, but I will support them and help them through that. No matter what they do, we can figure it out. But I like that, you were able to share and really describe. I think for some people, they don't understand how bad that OCD and anxiety loop can get, that it can lie to you to the point where it's almost like, you know, delusionally, you're laying there thinking you have 7 cavities and you've none.
Yeah.
Yeah.
I, and I tell myself all the time, and I'm good now. I go to the dentist every 6 months. Go me. It's a normal part of my life now. But I kind of have to tell myself, like, look, I am not a dentist. My OCD and anxiety is not a dentist. I will only listen to someone who went to school for 35 years to become a dentist
Yeah.
to tell me if I have a cavity or not. Period. Period. I don't know what a cavity truly looks like or not, like, or feels like. I have no idea.
Well,
you
and I think
know?
this is the part where you having had experience with this, having to go through your own exposures at various points in your life, and the creativity that it takes to handle things like overlapping OCD and PTSD, terrible anxiety, terrible panic.
Sure.
I think that is what, that's why I hired you. I saw it immediately that you were so creative and so innovative with figuring out immediately, where do we need to go? How do I need
Mm,
to connect with this kid? Where do we need to go in terms of exposures that will be appropriate level and not, yeah, exactly, like flood them with anxiety. And how do I do that in a creative way that also, includes their values and helps them, that, partnership helps them do the exposure and also have a great win that shows them like I can get my life back.
sure, sure.
Yeah.
And like I'm sure you see in your work, it's not just coaching, but like I feel like we're the best salesmen in the world, salespeople in the world, because like we're selling people their lives. People who don't think that they're worth it, or people who don't think they're going to change, or people who don't think it's a possibility to leave the house without having an accident.
Yeah.
It's our job to convince them and to sell
And to
hope.
challenge, yeah, challenge that idea and say, or maybe it's not that, or maybe it's not going to turn out that way. Let's
Yeah,
give it a try and separate that out. Like that isn't you. You are
yeah,
you, and the anxiety is a loop. And let's see if we can change that pattern.
sure,
Yeah.
sure. Um, you know, it just doesn't sound like it's going to be fully an exposure case in the sense that, so if this was a true exposure case, I'm offering a little reassurance in the sense that I'm like, I don't think it's going to happen, right? That's reassurance. Reassurance isn't always a bad thing unless it's in the exposure world. The exposure reassurance is exposure's worst enemy. One thing that is possible, and this works for some, usually works with younger kids,
Hmm.
um, but it's where the exposure is, I did poop my pants. How am I going to deal with this?
Yeah.
How
Yeah.
am I going to deal with this? How am I going to deal with this? Right. So that's like, I don't know if he is. Do you know anything about like his bathroom habits? Is he sitting on the toilet and straining? Is he trying to avoid everything before leaving? Is he withholding certain foods? Like,
Yeah, so
how
there's
is he
a
altering
lot
his
of,
life?
exactly, there's a lot of more, nuances to what his daily pattern is to just even see if he can get through the day. He has, we are approaching now, let's say it's, early July, we're approaching no loose stools and actually like things
Mm,
are really going well. Um, and the GI doctor has a new medication that's really like working for him.
yeah,
But he continues to have some of these patterns just to make sure. Yeah.
yeah. And the just to make sure's are accommodations for himself, essentially, which is like, sure, it's fine to wipe one extra time to make sure there's nothing left. But if we're wiping until we bleed, or
Yeah.
if we are pressure washing with a bidet, like these are all things that, in other cases will probably happen. And that's the O and the C in the obsessive compulsive. I'm obsessing over having an accident or, more came out and the compulsion is
I smell like poop. There's all kinds of ways it can go. So
checking,
that's
picking,
right. Yes.
changing clothes, changing underwear constantly. So these are all things that I probably won't be asking. I'm probably going to be looking out for.
Yeah.
Are
So
we
I'm
changing?
hearing, listening
Are
for.
we changing outfits all the time? Um,
Yeah.
Picking. There's a lot of picking, checking, smelling. These are all things I'm going to look out for because there is a chance that there are. I'm not here diagnosing, nor can I, but there's a very good chance this is going to, the Venn diagram is going to have OCD. There's
Yes.
going to be OCD in there for
Yes.
sure, and it's going to be treated whether it's disordered or not. I think it's important to look out for those things because these things can grow and they can fester and it can get much, much, much worse.
Yeah. And I think what's phenomenal about treating OCD and when you do, a scale listing all the common areas where people can have obsessions and compulsions, often they have multiple, in multiple areas. And then people will ask, how does this work? How does exposure in one line end up affecting the rest of it? But it does mushroom in the same way. So your accomplishments in one line of how the OCD is manifesting starts to affect the rest of the, obsessive thoughts that might be completely unrelated. And people really feel empowered and get their life back, like you talked about.
Yeah, yeah. And I think that's why the term coach or the title coach is appropriate for what I do, because like I'm coaching someone not back to health, right? But I'm coaching
Right.
someone back to a life
Yes,
working,
exactly.
living, you
Yes.
know?
Right.
Um,
That is not based every day, every moment in fear. And how do I work myself around that instead of just confronting it head on?
sure. And I'm working solely with who they are and what they have to offer. I'm not pulling from external things. I'm not providing meds. I'm not pulling out papers and books off the shelves.
Yeah.
You are what I have to work with, and I'm going to find things to work with. And probably just have to reorganize a few things in order to get you back on your feet.
Yeah.
Um, yeah, step one, rapport.
Yes. Yes. And
Really what it comes
that's
down to.
such a big thing.
Yeah.
Any final thoughts? But otherwise, this was really, I think, informative. And actually, like, you taught me some more things that I didn't know about you and how you approach things. I think it's phenomenal.
Yeah. No, I don't think so. I think there are so many different ways to approach things, and I think my favorite thing is to just throw everything but the kitchen sink at the wall, and whatever sticks, sticks. I mean, there's no right or wrong way to do things. As long as this person is getting better and feeling better about themselves, I've done my job,
Absolutely.
So
It's great.
great. Yeah. Thank you for this.
Thank you.
I love to nerd out about this stuff. It's fun.
It's amazing. We'll do this again. Different topic.
Yeah.
Great. All right.
Yeah.
Thank you so much, Evan.
Thanks, Steph.